The National Health Service is one of the most diverse organisations, not just in Britain, but in the world. And the National Health Service and the Windrush are two twin events. They took place days apart. It was on the 5th of July 1948 that the NHS opened its doors to the nation, Vesting Day as it was called. And that was just 12 days after the Windrush had landed at Tilbury Docks, marking the beginning of post-war migration from the Commonwealth. And from the outset, the new NHS relied upon the migrants of the Windrush generation and from those from the Indian subcontinent and from Ireland. By 1960, 40% of NHS junior doctors came from Pakistan, Bangladesh or Sri Lanka. And by 1965, Jamaica alone had sent 5,000 nurses to work in the NHS. For millions of British people, their very first encounter with a person of colour, a person with a different skin colour to them, was on the wards of an NHS hospital or their local GP surgery. And today, around 18% of NHS staff are minority ethnic, and around a third of all the visas given out to skilled migrants to come to the UK are people coming to work in the NHS. In certain parts of the country today, the reliance of the NHS on migrants and people of colour is overwhelming. In Wales, Rhondda Valley, 73% of GPs are from India and Pakistan. This is a twin story, the story of movement and migration, of new communities coming to Britain and establishing themselves in Britain, and our most beloved institution. And I think it was only during the pandemic, when Black and brown members of staff suffered by far higher rates of infection and death in the pandemic, that we really began to notice afresh just how diverse the NHS, the biggest employer in Europe, is, just how much it relies on people who have travelled the world to work here. And of course, it's not just people who have come to work in the NHS to find employment. The NHS is full of people who've come to this country because of the NHS, who wanted to work in the NHS not because it was in Britain, not because they just needed a job, but because they believed in the NHS. The legend of the NHS, this health service, available at the point of need, irrespective of income, this phenomena, this great British invention, inspires people like the great Kailash Chand to want to come to Britain to work, not just in medicine, but in the NHS because of what it stands for and what it is. That's the scale of that national institution, that it has international appeal, international reach.